Hi everyone, this is Neil Writer, consultant audiologist and director of ClearWax. Thank you for joining me in my latest video using the iCLEARscope endoscope. So this is of a patient who has been visiting me since 2017, typically twice a year, but it's the very first time I've uploaded one of their ear procedures online. And the main reason for that, particularly when I first started uploading videos, you'll get loads of silly comments about a bit of wax being left behind. And this patient's ears normally, they're not squeaky clean after I clean them, and that's due to the consistency of the wax. They've got a very wet, mushy type of wax, particularly in their right ear, and that's the ear that they normally attend experiencing problems in. But ironically, the last two visits, it's been their left ear that they've felt that they've not been hearing as well, although there was more wax in their right ear. And around the periphery, you can see they've got this very mushy skin that doesn't really want to come away. And you'll see a better example of that in their right ear. And it's just enveloped this plug of wax. So I'm sure I'm going to put some more oil, or will it come away? I think it's just come away. But in their right side, I put a lot more olive oil. What was interesting is a recent ClearWax specialist that we trained asked why I use olive oil in softer wax, because they've not probably seen some of the videos and the benefits of it, but during our training course I was applying it in soft wax, and I explained that it helps to coagulate and bind the soft wax. So they would normally only use olive oil with really hardened stone-like wax, but actually I tend to use oil more with really softer wax. So I'm just trying to get some of this away. The problem with the skin, as it's more on the right side, as you're trying to peel it away, it's not really suctioning, it's just smearing across the canal wall, so it's counterintuitive really. Just going to be careful that we don't get any clarinetting, because that's when you suction skin, the skin can violently flap. I think we've just got a little bit there. So I'm going to go back in with a smaller suction tip and just kind of cut that skin away. Smaller suction tips are generally reduce clarinetting, they're a lot more effective. Now I'm just mopping up the entrance a little bit. This patient does wear AirPods, and before, the AirPods used to always get blocked with wax. I think they've got some new ones where they've got some sort of filter or gauze to protect the speaker from wax. I've never used manual instruments in this patient. I tried using a correct many times before on the right, but they just don't tolerate it. The bony part of the ear canal for them is so sensitive that even with some mild contact, they just find it a bit uncomfortable. So I only ever use microsuction in this particular patient. They can't undergo irrigation. They used to prior to seeing me back in 2017, but they would always develop otitis externa, so an ear infection as a result of the water entering their ear. Now the right side, I was fortunate today because normally the wax is smeared all over the eardrum, and they've got what we call hyperflaccid or hypercompliant eardrums. And I do too, so I know exactly kind of some of the, not symptoms, but what can happen when you do. So whenever I go through a tunnel or up and down a hill, for example, whenever there's any pressure or altitude change, my eardrum is very sensitive to it, and it vibrates quite a lot, it flutters. So when I used to perform microsuction on their eardrum, you can actually feel the eardrum move, you can see it physically flutter and vibrate. So this is the right ear, so this is a bit of a wetter type of wax. It's normally even wetter than this. So I've just dosed it with olive oil just to bind it. I'm going to use olive oil several times actually in this ear. I'm just trying to mop up the entrance a little bit because some of the wax is right lateral, and there's a few hairs there, so the oil will coat the hairs and it can smear the lens, which it did happen on a couple of occasions. So the way I'm going to tackle this, initially I was trying to peel it off the canal wall, trying to mobilize the central plug so that I can bring it out. But when I was taking it off the canal wall, and you'll see it here in a moment, that mushy peripheral dead skin wasn't really suctioning, it was just smearing. It wasn't coming away as I was liking it to, so it's not separating basically. And what I'm going to do is put some more oil in a minute, go to the middle where I am now, and almost just wiggle this out of the ear, and it fortunately came out in a plug. So there is a bit of an opening at the top, so this is probably why this patient didn't, although there was a bit more wax in here, they experienced more symptoms than their left ear, because the left ear was more occluding. There's less open space between the wax and the canal wall. So here's me again trying to just peel off the canal. It wasn't coming away, so just dosed it with oil. Gonna just clear some of the excess. I was actually suctioning the oil with the patient's head tilted over, so I was standing up going into the ear. I find that works better, but one of the things you're going to be careful of is the wetter the ear is, so the more liquid in there, the noisier the suction can be. But there is techniques to minimize noise. So by keeping the suction tip on the wax as often as you can, it actually reduces suction noise quite a lot. And there's other techniques, so there's ways around that. But having the oil in the ear, it just makes it a lot easier, sort of them draining the oil. So in a moment, I think I've found the sweet spot, and I'm just gonna wriggle this, and it's gonna try and come away in a plug. And I'm always trying to keep the suction tip on the wax. Occasionally some of the wax gets suctioned up, so it breaks that seal, but this is minimizing the noise. I think it just got blocked there. So I'm just gonna re-enter. And I was dreading it. I thought there's gonna be so much more wax on the eardrum. But lo and behold, there was nothing on the drum today. So I don't even think this was on the drum, because if it was, there'll be some smearing, but the eardrum was squeaky clean. So, and it's probably the best view I've ever had of this patient's eardrum, because there's always been some residual wax on there. So there's going to be some residual wax, and it's mainly mushy skin. And some of you guys might think, oh God, there's a lot there. Well, I tried my best. With the suction, as I said, I'm not going to use a correct in this patient's ear, it's just too sensitive. And there came a point, and you will see it, that it's not suctioning anymore, it's just smearing. It's just coating against the canal wall, so it's a pointless exercise continuing. And if the patient came with this amount of wax to me, saying that they can't hear because they've got all this wax, I would say to them, it's not the wax, there's some other problem causing your hearing loss. Remember guys, you're looking at a really magnified view here. So I'm just going to the back. And again, I'm just trying to take as much out as possible, because this patient wears AirPods. I'm just trying to minimize any potential blockage, but I was hoping here, as I'm peeling the skin, it's all going to come away, but the skin just breaks away, unfortunately. And there's a few hairs there that it's got slightly matted, so that reduces suction power. So again, I'm being really, really careful. I'm just gliding across the surface of the ear canal. So we're on the cartilage portion there, so we can apply a bit of pressure. Again, I got hold of a bit of skin here, and I was hoping it would peel, but it just wasn't coming away. It's quite adhesive skin. Again, I just want to see if I can get some excess, but it's probably I've not probably uploaded a video before like this, but there's probably quite a lot of residual wax left, but I'm happy with that. Any ear care specialist who's learning to perform wax should be comfortable with that as well. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.